Hi, this is Dr. Corey here, and I'm here to just introduce you to some of the equipment that we're going to be using throughout your neuropathy program. The first one we're going to cover is the peripheral nerve rehabilitation therapy, which is utilizing a product called the Rebuilder. This Rebuilder is going to be very, very beneficial for you in decreasing the pain and increasing the activation to the cells and tissues of your feet. So it's super, super important that you understand how to use this. In your package, you're going to receive a transmitter, which is here. Very, very handy. It'll fit in your pocket. You can use it. We've got a travel case for you, so you can take it on vacation with you as well. We've got an instruction booklet also, so if you have any other questions, you can reflect back on the instruction booklet. But it's very, very simple to use. You're going to also get 4 of these pads, and we're going to be putting these pads on the feet. And if you have neuropathy in the hands as well, we're going to also be putting those on the palms of the hands. So without further ado, what I'm going to do is I'm going to just step out for just a minute. I'll be right back with you, and we're going to show you how to use the equipment. All right, so we're back now, and what I want to do is just walk you through the steps on how to set up the Rebuilder so that you can get your peripheral neuropathy treatment and start on your journey to becoming pain-free. All right, so we have a patient here, and as I mentioned earlier, we're going to be getting that Rebuilder unit. We've got 2 prongs on each side, and then we have pads that are going to go on that. So what I'm going to do is I'm going to take one pad and we're going to plug that in. And as you see, it's going to fit right in there nice and snug. We're going to take that other end, oh, there we go. We're going to take that other end, we're going to get one more pad, and we'll put the excess ones off to the side. And once again, we're going to plug together so we have the pads connected to the wire. And we're going to put that Rebuilder right to the side. We don't need it for now. Now what you're going to do when you're at home is you're going to take that sticky part of the pad and you're going to go ahead and relax your leg for me. We're going to put that on the bottom of the foot. Let's go ahead and lift that up, and I'm going to put your foot up there. And so we're going to put that right on the front half of the foot. And as we do that, let's go ahead and lower that one down. We'll come back and we'll do the same thing on this side. We're going to lift that up. We're going to put it on the front half of the, right behind where the bones of the toes start there. So you're going to see that right there. And as we lower it down, we're going to go back to our controller. And what I want you to feel, you're going to turn it on, you're going to see a light start to flash on here. So as we see the light flash, we know the power is on. And in the process, what we're going to do is we're going to turn it up just nice and slow. You're going to start to feel a tingly sensation. Go ahead and lift your hand when you start to feel that tingly sensation come into the feet. And there we go. Okay, so we found that spot where she starts to feel the sensation. So this is going to stimulate the nerves, which is going to start to bypass that pain signal. The more stimulation we get into the feet, the more your body's going to start to take on that normal function again. And we're going to cut off what we call nociceptive pathways. So she can feel that now. And what I'm going to have us do now is we're going to turn that up just slightly until we can start to see just a little stimulation, a little muscle contraction coming into the calves. So we're going to do that now, and I'm going to go ahead and do that now. And okay, and do you feel that now?
Yes.
Okay, so she's starting to get a little pulsation, and I'm going to zoom in here so you can see that little movement there. But we want to just take it to that point. Once we get the stimulation, I want it to be comfortable for you. So we're going to back off just a little bit so you get that little bit of tingly sensation. And as we back it off, I want it to be comfortable enough that if you wanted to, you could go to sleep, okay? I don't want you to sleep with this for extended periods of time. There is a 30-minute limit that we want you to stick to per session that you're going to do your rehab. So please do not go to sleep with this on and keep it firing all night long. I want you to just do this in 30-minute increments. You can do it twice a day, but let's just use it on a consistent basis. We'll keep it at a lower setting, like I said, so it's comfortable. We'll turn it up to that one point where you feel the muscle contraction into the calf. We'll back it down so it's comfortable, and then we're going to set that and we're going to let it stay on there for 30 minutes. I hope this has been beneficial for you. If you have any questions, by all means, contact us through our support at fixmyneuropathy.com. Thank you so much, and we'll talk to you on the next video.